Hi, my name is Susan Nabate Wamala. I'm the Executive Director of GIBEH Uganda. GIBEH in full is Girl Initiative for Better Education and Health. GIBEH Uganda is a youth-led non-profit organization working around children, especially advancing their education and health rights. We focus more on the girl child because they are most vulnerable in most spheres of social justice and life. Growing up as a child, I grew up in a family of 10 children, of which 9 of them were girls. But we faced many challenges along the way, having lost our father at a very tender age. Their education was quite hard, and even looking for the basics of life became quite hard. And growing up, right from my primary throughout secondary, I was sponsored by different people. Some I've met, some I've not actually met. And that was the idea behind forming GIBEH, or establishing an organization that helps children, especially girls, achieve their education rights. It started as an outreach where we could reach out to different communities and seek for those children who could not afford education, those that were vulnerable, but also we had considerations of those who had lost their parents due to HIV, who we usually call HIV affected. And we took them on as an initiative, as an outreach, to simply pay for their school fees and provide for their basic scholastic materials, buy for them uniforms, buy for them shoes, and to us that was satisfying at the time. However, in 2019, we resorted to establishing GIBEH as a non-government organization, and thereon we went ahead with the registration of GIBEH. We've been able to touch different lives of children, especially those in primary and secondary school. For primary school, we have been more in basic education, where we help children with school fees, those who are most vulnerable, and by this we mean orphans or children who are affected by HIV/AIDS, including those who are facing disabilities, different disabilities. We help them with the provision of school fees and scholastic materials.
Bade ndinayo omusajja naye twazaalayo abaana babiri, naye twatakalanyamu ne twayawukana. Kati ne ndaba e Rwanda embeera si nnungi, ne nja wano mu Uganda n'abaana bange babiri.
Amanya gange nze Namazzi Stella ow'Ennakwelobbi, nga ndi wano ne mwala wange Zaalwango Joyce, ng'era neebaza aba GIBEH abajja ne basisinkana ambirako kawala kange kano, era nnyongera okubeebaza kubanga mbadde siina busobozi.
My school is Gayaza Church of Uganda Primary School. This is my brother. Tweyanziza abakyala abatuyamba okusoma.
But also that is not enough. Given our vision, it's not enough for that. That's why we go ahead now and do outreaches within the communities, outreaches within the schools, to ensure that children and parents and guardians, together with the different stakeholders, understand the social barriers against girl-child education. These have been noticed by us in our engagements in communities, and we try so much to give sensitizations around that. One area that stood out for us last year and this year has been the menstrual health and hygiene management of the girl child. We realized that this has not only been a stumbling block to education, but has led to a lot of teenage pregnancies among the girls. One is because many of them don't understand their reproductive health, they don't understand their body autonomy, and most times when they don't understand this, that's when they fall prey to teenage pregnancy. So when we go into the communities, we are sensitizing the girls on their reproductive system and how normal menstruation is and how it's not a taboo. And we try to break those cultural norms or religious barriers where they're saying that when a girl is menstruating, then it's a taboo, they shouldn't do this, there are less of girls, they shouldn't cook. So we try to break those stereotypes, but also our major focus has been on breaking stigma around menstrual health in our communities. And that is when we came in to help sensitize people on what gender-based violence is exactly, especially the children, to understand how it starts, how it leads, the effects of gender-based violence, especially on the girl child. And by this, we help them understand that when these happen, there should be justice, maybe to the people who have caused this sort of violence. And that's when we teach them about the referral pathways that they have to go through in case they undergo gender-based violence, or they know someone who has undergone gender-based violence. We need to ensure that when all these forms happen, the girls are protected, one, from the HIV that comes with it sometimes, or the unwanted pregnancies, but also that it stops. When we are sensitizing communities about gender-based violence, we not only target those who have been violated, but to stop the vice from reoccurring within the communities, to help understand the effects of gender-based violence on the girl child and how it can affect them throughout their lives. And we're trying to ensure that at least to prevent it in communities so that doesn't happen. That is protect our children. But also the other area GIBEH has been involved in much is HIV prevention among the young people. This is due to the fact that young people sometimes live reckless lives and they don't notice the effect of what could happen to them years after their youthfulness. And when we do HIV prevention, we have counseling sessions for most of them. Sometimes when you go into the communities for HIV awareness or HIV prevention sessions, we're able to identify some of them who would like to know their statuses. We take them through counseling. Those who need to go and do antiviral treatment, we help them do that. We have counselors at GIBEH Uganda. So our work has been in line with children, but also we are targeting on helping juvenile offenders. Sometimes GIBEH has noticed through our work that the juvenile justice system in Uganda has been so much broken that we are seeing children as young as 14, 16 being taken to main prisons such as Chitaria, Luzira, which sometimes is not a recommendation because the Ministry of Gender with the Uganda Police had released the diversion guidelines for juvenile offenders. But we realized that these were not followed, and this is one of the things that we try to engage to see that juvenile offenders are protected. So our work is majorly on protection of rights for children. We try to work with local leaders. We work with the Goma division, given the fact that we are centered around Sonde. We work more with the CDO, we work more with the probation officer to ensure that the children's rights are protected within our communities. Doing our work has not been smooth, given the fact that we are relatively a new organization. When we had just registered, our first challenge was we were hit by the COVID-19 pandemic. Imagine having been registered, then we went into lockdown for close to 2 years. So by the time we came back to kickstart work, we had lost 2 years of our licensing, and that means we had to do work within the left 2 years. So to us, the COVID-19 period was a setback, a real setback for the organization, but we picked up nevertheless. However, during the work that we do, we have realized that there is a need, a dying need to protect girls, to protect children, to protect their rights, protect their education rights, health rights. However, sometimes we are limited in our financing, and many of us, given the fact that we use more of equity financing, we cannot reach the wider community that our vision gives us, because we envisage to reach close to 15,000 children. However, we have reached close to 1,000 because of limited funding. But we know if we had the necessary funding, the necessary financing to push our work, we would definitely do that. Some of the challenges we are still facing in our communities is the lack of responsiveness from communities. Realize that some of the violences against the children are perpetuated by the people who are supposed to protect them. These sometimes are the parents, these sometimes are the guardians, even the fathers themselves. And most times, even the mothers, when a child is facing, let me say, gender-based violence, it's the mothers who are quick to protect the perpetrators if it's a family member, so that the family doesn't go and distribute. And in that regard, they are destroying the justice or the would-be social justice for the girl who has been abused. So we also call upon different stakeholders to work with us in the work that we do to ensure that we help the girls realize their full potential as they live within the societies, so that they can become better citizens, better people, and in turn probably come into organizations like this.